Good morning, everyone. Thank you for being here. We, as the House Democratic Caucus, are excited to share with you today our bold vision for rebuilding our state through investing in Oklahomans. Although progress has been made in some areas in the last few legislative sessions, Oklahomans know that we are still far from where we need to be. Our classrooms are still overcrowded, and so are our prisons and jails. We still have many Oklahomans who don't have access to quality, affordable health care, including mental health care. And even though we hear many in this building brag about a low unemployment rate, we know that they are forgetting the thousands of Oklahomans who are working multiple jobs and still struggle to support their families. It's because of those fellow Oklahomans that we feel it necessary to put forth this aggressive legislative agenda that truly moves the needle on areas that have long been underfunded and undervalued. This agenda, the Brand New State agenda, was a collaborative effort and was created by every member of this caucus. We have 4 main policy areas: healthcare, criminal justice reform, education, and jobs and the economy. And each member was asked to participate in crafting the agenda in one of those areas. We will now hear from our 4 policy chairs to talk more about the specifics of the Brand New State agenda.
Good morning, Melissa Provenzano, State House District 79 in Tulsa, Oklahoma. We all know that receiving a good education is what lifts a child and puts them on track for success, yet many Oklahoma children are still waiting for the state to aim for the right goals to help get it done. We have a plan for education that puts Oklahoma children first. Imagine if we simply applied what we know and that research consistently supports, that a well-trained, experienced teacher makes the single biggest impact in the educational experience of a child. We need to create a teacher pipeline that recruits the best and keeps them in the profession for the long haul. Then we need the people that wrap around that teacher to help get the job done. Take school counselors. Imagine if they could spend the bulk of their time, if not all, not as exhausted testing coordinators, but instead providing mental health and academic supports that keep students on the right track. We also need authentic measures for school accountability that don't hang a questionable letter grade on a child or on a community. Kids learn and grow in different ways and at different rates, and it's time to make the measure match that. Many of our students are considering college, but fear they may never be able to pay off the loans that they have, nor that they will receive a fair deal from our lenders. Half of the students graduating from Oklahoma institutions carry, on average, $25,000 in student loan debt. Long gone is the notion that one can get a job to pay your way through college. Increasing faith in the lending process with a student borrower bill of rights will promote higher enrollment in our institutions, which are well known as some of the top teacher training grounds nationwide. Lastly, I imagine we all know it doesn't come cheap, so let's set a big and audacious goal. We can and should be #1 in the region in per pupil spending. We simply need the political will to do it. Again, our schools know what works and they know how to get it done. They just need real support from legislators that get it. We simply have to make the choice to build a brand new state. Thank you.
Good morning. Colin Waukee. I represent House District 87 in Northwest Oklahoma City. We want the citizens of this state to know that we have heard you. We are listening. We know that the work on criminal justice reform did not end with State Question 780 and 781. Our plan seeks to increase state funding for diversion programs that have proven successful, like drug courts and mental health courts in our state. Less than a quarter of our counties actually have mental health courts in this state. Expansion of these programs would save taxpayers $15,000 per participant versus incarcerating them. Those savings could then be used and reinvested in how we fund our court system and lessen our reliance on fines and fees, which over the last 6 years has led to more than $600 million in delinquent court debt. This debt trap then leads to disproportionate jail stays due solely to an inability to post bond. creating a debtor prison right here in the heartland of America. If you can't afford bail and you're in jail for the same reason for somebody who can post bond, the only difference is a matter of wealth. And wealth should not decide justice. Justice is blind, but she hears us. And with our plan, we can become a new state that leads the nation in being smart on crime, not just tough on crime. Good morning. My name is Micky Dolenz. I represent House District 93 in South Oklahoma City. A brand new state's economic agenda is an economy that works for everyone, whether you're from rural Oklahoma or urban parts of the state, whether you're actually in the workforce or you're retired. House Democrats have filed 17 bills that will improve the economic empowerment for citizens across the state. A few of those examples is raising the state minimum wage. It also involves restoring local control back to municipalities to set their own state minimum wage. We believe in giving retirees a permanent cost of living adjustment and expanding and investing in apprenticeship programs and workforce development to meet the demands of a 21st century economy. In addition to these bills, we are addressing regressive tax policy that has placed an undue burden on working class Oklahomans, in particular, restoring the earned income tax refundability. By doing this, we will ensure that over 300,000 Oklahomans will have money back into their pockets by ensuring that they're getting their full earned income tax credit. Look, at the end of the day, Oklahomans just want to be able to know that they can pay their bills, put food on the table, spend time with their families, and know that they can progress forward up the ladder. It's with these values in mind that the House Democratic Caucus has put together our economic agenda. You can learn more about the 17 bills that we've filed to improve the lives of Oklahomans by visiting a brand new state, OK.com. Thank you.
Good morning. My name is Forrest Bennett, representative for House District 92 in Midtown, downtown, Southside Oklahoma City. This session marks 8 years since our state's leadership rejected Medicaid expansion and the $3.5 billion that we would have now had in our communities to make lives healthier for our taxpayers. We have waited far too long, along with hundreds of thousands of frustrated Oklahomans, for that long-promised Oklahoma solution to come along, while we watch 36 other states improve their health outcomes considerably as a result of traditional Medicaid expansion. Since that time, Oklahoma has earned headlines for all of the wrong reasons. We're currently 45th in public health, 46th in healthcare quality, 47th in overall healthcare, and 48th in healthcare access. It's kind of nice that they're all bunched together, but that's the only nice thing about that statistic. These are just statistics, but they represent very real Oklahoma families in my district and those of my colleagues. We know that they're facing very real challenges, and we know that straight Medicaid expansion is the quickest and most efficient way to get much needed help to our population. We know this not because we're guessing, but because we've watched, again, 36 other states implement it and see success. What we don't know is how successful the block grant model would be. We don't know if it would meet the same standard, but all available information suggests that it will not. We simply cannot afford to use our state's most vulnerable population as test subjects for the newest Washington, D.C. effort to gut healthcare protections. And we're first to admit, of course, that Medicaid expansion isn't the silver bullet we need to fix what's broken in our healthcare system. There really isn't a silver bullet because we've ignored this problem for so long. Nearly 1 in 4 Oklahomans struggles with a mental illness. 1 in 10 struggles with addiction. And the challenges facing these folks who live and all too often die with these afflictions are too great. The stigma alone is a huge challenge, and the least we can do as a society that values human life is to help our fellow Oklahomans and actively work to reduce barriers for them. Oklahoma loses a mom every month and a baby every day. Our infant and maternal mortality rate, well, among the highest in the nation, doesn't really reflect that pro-life attitude that so many leaders in this building promote. And we've said it 1,000 times before, and we'll say it again. The difference between being pro-life and pro-birth is how we treat those mothers once their babies are born. And in Oklahoma, we've got a lot of work to do. Across the country, prescription drug prices are skyrocketing. And while we wait on the federal government to do something, anything, states across the country, from coast to coast, are taking innovative steps to lower prices. Drugs like insulin, which type 1 diabetes patients need to survive a disease that they did nothing to contract, are climbing in cost for no other reason than profit margin. We see states like Colorado and Illinois taking innovative steps to ensure that families aren't choosing between filling that prescription or filling their pantry. We can and we should join them. We see healthcare the way everyone should, as a smaller piece of a larger puzzle that must be intact for our state to see true prosperity. All of those issues, healthcare access, criminal justice, economic opportunity, and education, they're all intertwined, and the day that we as a state recognize that is the day that we will right our ship and the tide will rise for all Oklahomans, not just those with the wealth and resources to access the best in all of these categories. The time is now, and House Democrats stand ready to work with our colleagues all over the building to address these issues and bring that brand new state sense of hope and optimism back. Thank you.
We, as the House Democratic Caucus, feel strongly that through this agenda, we can unlock the potential of Oklahomans all across the state. For too long in this building, we've focused and invested on those people who can afford lobbyists, wealthy Oklahomans and corporations. And it's time that we focus on working families, our neighbors. Those families have seen a state government for a very long time that has not invested in them. And we believe that the brand new state agenda is far better than what they've seen in the past few decades. We call on our colleagues across the aisle to work with us to implement these bold, aggressive policy areas. And we look forward to a legislative session that will be a success for all Oklahomans.